In line with the country's objective to enhance capacity when it comes to testing, the University of Health and Allied Sciences Laboratory has also been brought on board. And this was a key initiative by the Vice Chancellor in collaboration with the Regional Health Directorate and the whole teaching hospital. They initially sent lab personnel to Noguchi to be trained. Noguchi also came down to come and inspect what they have here in Ho. They later on came back to come and certify it. And then so far they've also sent logistics down. That includes the reagents to the laboratory at the University of Health and Allied Sciences. The lab personnel have had several simulation exercises just to make sure that they are very proficient in what they are going to do. On Monday, 27th of April, we are going to begin testing at the University of Health and Allied Sciences. The initial capacity is 60, but as time progresses, the capacity would further be enhanced. Usually, you want to control it. You want to start with a smaller number, and then as you proceed, you increase the capacity for testing within you increase the capacity for testing. So they have a state-of-the-art facility at the University of Health and Allied Sciences, and it's comparable to any of the very good labs that you have in the country, and it's a good addition to case management within the Volta region. Now that we are going to begin testing at Uhas or in the Volta region, initially the delay that we had, we started with 24 hours. When you send samples to Noguchi, you get your results in 24 hours. And then because of the pressure on Noguchi, it got to a time where we were getting feedback 3 to 4 days or 5 days later. And what this does to the system is that you are going to hold more suspected cases for a longer period. And when you have a suspected cases, it is positive until proven otherwise. So all the measures that you have to put in place, all the PPEs that you have to use, you ought to use it. So it will be pressure on the staff. It will be pressure on the resources that you have. So now that we are going to have the lab running here in the Volta region, we are going to have our results back within the shortest possible time. We anticipate that with the current numbers, it will be within 24 hours so that we can communicate back to our clients in the shortest possible time and then relieve them of the anxiety of waiting for 5 days. It's not only going to serve the Volta region. It's going to serve the OT region. It's also going to serve some parts of the Eastern region, especially those who are close to Ho. So it's a very important addition to case management in the country.